Hi, everybody. My name is Troy McCormack, and today my presentation is on lung volumes, the capacities of the lungs, and their importance in a pulmonary function test. This is a very important and dear subject to me because I actually have asthma, so very um, very important topic here. So here we have the lungs, um, and what they do is they take in air and oxygen. It comes in through the trachea here and goes down, branches off into the bronchi and into the bronchioles in these little things here, and then uh, ends up finally in the air sacs here, which are the alveoli. And that is how air comes into the lungs, and in the alveoli is where carbon dioxide and oxygen are exchanged into the blood. So one of the things that could really affect the lung capacity is certain conditions. We're going to go over a couple of conditions, and then we're going to talk about how this is tested in a pulmonary test. So first we have asthma, and in asthma there is these bronchioles which we were talking about, and in a normal they're open. So here's a cross section here, and they're completely open, and you could notice the muscles here. That's going to become very important during an asthmatic attack. So in an asthmatic attack, those smooth muscles, they start to contract, and it decreases the size of the airway. So you can see here it's much smaller, and then it also gets filled full of mucus, and it gets inflamed, and it just makes it so that the amount of air coming into the lungs is much less. And this is a big problem, and it really can be treated, which is what I showed you earlier with the nebulizer. So another condition that affects the lungs that that can be checking for in a pulmonary test is bronchitis. And bronchitis is normally caused by bacteria and viruses. It can lead to things like pneumonia, which is an infection of the lungs. Um, and what happens here is pretty much like asthma. The only difference would be that the cilia are damaged, and that could be because of the infection there. Um, and what that's going to do is it's going to stop the motility of uh, mucus coming out of the lungs. So just another condition here, just going through this, I think this is the last one, but is emphysema. And emphysema is something that's caused primarily by smoking. And here we have a diagram here of what's going on. And what emphysema means, it's a breakdown of the alveoli. And what's going on here, you can see how little tar specks and harmful particles are being trapped in the alveoli, and then it triggers an immune response, which causes the immune system to break down the alveolar septum, so that all the little parts in between the alveoli, and then it just becomes this big open cavity, and it's lined with all these carbon deposits. So right here, this is full-fledged emphysema, and you can see here these are the pictures that you would see like on a cigarette packet, or um, warning us about the dangers of smoking, because smoking will eventually lead to this emphysema in people who have this immune response right here. So emphysema is also something that can be tested with a pulmonary test. So zooming right along, I want to talk about lung cancer and how that can affect the a pulmonary test. Um, Lung cancer, COPD, and emphysema. So these all three things are pretty bad. COPD is a chronic obstructive pulmonary disease, and which is like chronic bronchitis. And what we have here is a study that had been done where they found that lung cancer has been linked to changes in lung function, um, of course, and these changes are often seen as being a factor in smoking, yet it's not as straightforward as it may seem, because even non-smokers with emphysema have an increase of lung cancer. So, um, there's something going on between emphysema. There's a link between emphysema and lung cancer, and this has been this study here has found that you're looking at the top lobe of the lung up here, looking at the top lobe of the lung is very indicative of whether or not somebody will develop lung cancer if they have emphysema in this upper lobe of the lung. Um, and finding effective treatments for that, but mainly in catching, trying to find new ways to catch the cancer before it's developed too much. Because as you can see, lung cancer, once it starts, um, it can just take over and it really affects the pulmonary output of the lungs. So when we think about lung capacity and lung volume, it's a good idea to pretty much visualize this graph here. Um, Here we have, most of the breathing that takes place is within the tidal volume, which is in between the 30 and the 37 here in milliliters per kilogram of volume, and that's the tidal volume. That's the amount of volume of air in or out of the lungs during quiet breathing, just sitting there, maybe TV watching. You think tidal volume, you think TV, watching the TV, not really doing much, unless maybe you're watching a scary show. Then your immune system might cause something to, you start breathing in a little bit deeper, and um, and when you breathe in deeper and you're ventilating a lot faster, then you're going to be affected more by your lung capacity is going to increase. So when we think about that, uh, consider that there's always going to be a little bit of air left in the lungs. You see here why the volume never reaches zero is because there's always this residual volume left in the lungs. And what that residual volume is a result of there be always being a little bit of air in the lungs as we're in the atmosphere right now. There's always going to be air in the lungs, unless let's say we go into outer space, then there would be no residual volume, and then we would have collapsed lungs. So it's very important to understand what these different terms are. So here we have the whole point of this is to figure out the total lung capacity, the TLC. And what that means is we're measuring the expiratory reserve volume, the inspiratory reserve volume, the tidal volume, the inspiratory capacity, and the functional residual capacity, as well as the vital capacity of the lungs. And all of these create amount of um, a measurable uh, amount of capacity for the lungs. So it can be stated that the total lung capacity um, is the sum of RV plus VC here. So that's the total lung capacity. And then all these are pretty much going to be some mathematical um, adding or subtracting to figure out what each is. So I mentioned before the residual volume, and that's after um, a maximum exhalation. After that, we have the ERV, which is the expiratory reserve volume, and that's the maximal volume of air that can be exhaled from the in expiratory position. Um, right here, that's what we're talking about. The IRV is the inspiratory reserve volume, and that's the maximal volume that can be inhaled from the in respiratory things level. So you can kind of hear maybe that's my inspiratory and expiratory. So the inspiratory capacity is the reserve volume and the tidal volume combined. So that's just the adding of those two. Um, the vital capacity is the volume of air breathed out after the deepest inhalation. And the tidal volume is that volume of air moved in or out the lungs during, the quiet breathing. And lastly, we have the FRC, which is the functional residual capacity. And this is the volume in the lungs at the end of the expiratory position. Once these baselines are figured, we can go from we can do things like finding out the residual volume over the total percentage of the total lung capacity, and that could give us a good indication of how the lungs are functioning. The actual volume of the lungs is called the VL, which is the volume of the conducting airway. The FVC, which is the forced vital capacity. Um, this is the determination of the vital capacity from a maximally exforced effort, and oftentimes all of these are figured out over a course of time. So we can figure out the forced expiratory volume over a given period of time, and all of this can give a good lung function test, and we can find out how well the lungs are functioning, as well as from things like the O2 concentration of oxygen in the blood. We can find out how well these lungs are working. So here we have pulmonary ventilation, and this is what we were talking about before. All of this is measured. You have atmospheric pressure, and then we have intrapulmonary pressure here in diagram A. This is before inspiration, and you can see here at this is at rest in A, and see right here at B we have the inspiration. So air comes in, the millimeters of mercury go down, and then there's expiration, and then the pressures increase, except for the one here inside the interpleural cavity stays relatively negative in order to allow for the lung to stay inflated. And the diaphragm is what controls the movement. So that as the diaphragm goes down here, it would draw in air, and as it's going up here, it would exhale the air. So a spirometer is an interesting device that allows medical practitioners to find out the function of the lungs. So what you do is the patient here would take a deep breath and blow as hard as possible into this tube here, and there's a clip on the nose in order to stop air coming out of the nose. And the technician would monitor and encourage the patient to breathe as hard as they possibly could, and they would make sure that they're actually breathing out and breathing in as much as they can. And this is going to be all put onto electronic computer graphing, and it's going to show that graph that we had previously to show exactly how much the pulmonary function is functioning, to find out if there's any issues with the lungs that could be saying maybe there needs to be an x-ray, or maybe they need to go in with a camera to check it out. And all this is dependent upon how this spirometer goes, or to figure out the severity of the asthma or the chronic obstructive pulmonary disease or emphysema. So one cool thing, I like to leave everybody with a little positive thing at the end. Um, I'm a dog lover, and they just found that these beagles here are able to detect lung cancer with 97% accuracy. Um, and this is according to the osteopathy medical research out of Lake Erie. And they found that these beagles were able to take masks, which are really cheap. So this is a really good thing, finding something that's cheap and effective. And they were able to smell these masks of people and have a 97% accuracy of finding people that had lung cancer. So, things like this, using a dog's nose, and you could see just a little snout here. They have so much more olfactory senses than we do, and we don't know yet the markers that they're sniffing for, but they're able to figure it out, and they use a clicker training, and it's pretty amazing what these dogs can smell. Thank you for your time, and here are the references that I've used for my presentation.